Good evening, and thank you so much for joining us this evening for our discussion on managing chronic conditions in the era of COVID-19 and beyond. Tonight's webinar is brought to you by Center for Change with funding through the Florida Department of Health's Closing the Gap grants. Center for Change is a nonprofit agency, and we offer a variety of services in Orange, Osceola, and Seminole County. Now, we invite you to ask about any of our services, especially our chronic disease self-management workshops, which we offer virtually, as well as our health coaching services, which provide our one-on-one interaction. Now, we also offer education and screenings for colon and prostate cancer. Now, we'll also provide more information on Center for Change at the end of this webinar. We're partnering tonight with Dedicated Senior Medical Center to bring you valuable information on how to manage your chronic conditions, even through these trying times. Dedicated Senior Medical Center is a family-owned primary and specialty care practice committed to delivering superior health care to Medicare-eligible seniors. Now, they recently opened a new facility in Pine Hills, which offers a holistic approach to healthcare. More information about their center will be provided after the webinar. As appreciation for attending this webinar and completing our post survey, which you will receive after this webinar, Center for Change will provide a gift card or a health-related tool to all of our participants, in addition to information about Center for Change and Dedicated Seniors Medical Center. And I know that you will find the information presented this evening to be a valuable asset in helping you to self-manage your chronic conditions. Now, our presenter for the evening is Dr. Cerphy. She's a primary care physician, and she currently serves as the Associate Chief Medical Officer at Dedicated Senior Medical Center. She's a graduate of the University of Miami Miller School of Medicine, and she completed her residency at Jackson Memorial Hospital in Miami. She's a dedicated physician who finds her work with seniors incredibly rewarding. Her compassion and desire to serve this population, it reflects in her deep commitment to improving the health outcome of her patients. Now, during the discussion tonight, if you have any questions whatsoever, please feel free to use the chat box that's here. Now, without further ado, I present to you Dr. Cerphy.
Thank you, Michelle. Such a great introduction. Welcome, everyone. It is a pleasure and an honor to be here with you here at Center for Change to bring this seminar to you so that we can learn more about chronic diseases and chronic illnesses. Now, especially in the era of COVID-19, which makes things even more complicated. So let's start by saying, what is a chronic illness or a chronic condition? We hear the word and the term thrown all the time, but let's take some time to actually delve into what it is and also what we can do about it. So, a chronic condition or chronic illness, it's a general term for an impairment or condition or disease that is lasting a year or longer in your body, and that also limits your activities of daily living. So it limits what you can do, the activities that you can perform daily, and also may require ongoing medical attention or medical care. Okay, so that's a chronic illness. And how about what is the burden of chronic illness in our society? So, as you said, this is something that we hear about very often. Sometimes we hear about it and we don't know if we're affected. Sometimes you hear about chronic illness. So many people are affected by chronic illness, but some people don't realize that they are part of that group of people who are affected by chronic illness. So, let's look at some numbers. So, according to the CDC, About 6 in 10 adults in the US have a chronic illness or a chronic condition. Now, that's 6 out of 10. That's more than half of adults in the US that are battling or dealing, managing a chronic illness. So, 4 in 10 adults in the US have two or more chronic illnesses. So, 6 out of 10 at least have one chronic illness. 4 out of 10 have at least two chronic illnesses. So you can think how many people are actually affected by the burden of chronic illness here in the US. So think about yourself, think in your family, your friends. Think about anyone that you know that maybe is not functioning as well as they used to. Maybe they're battling a chronic illness that they may or may not know about. So it's very important to educate yourself about this because, as you can see, it affects a very large portion of the population. So now let's look at some chronic conditions some examples of chronic conditions. Okay, so diabetes is one of the most common uh, chronic illnesses. So you have things like arthritis or what we call degenerative joint disease. So we have a lot of adults when they get into middle age or into their 60s, their 70s, they start complaining of arthritis joint pain. So inflammation in the joints and it limits their ability to walk. Sometimes their ability to work. If they do a work that requires for them to be on their feet. Some people are not able to play with their grandkids, play with their family members, so it affects their function. Osteoporosis, which is a very and osteopenia as well, very high risk for fracture, especially in elderly women. Cancer. We hear a lot about cancer. There's a lot of people who are affected by so many different cancers. So, heart disease, hypertension, which we also call high blood pressure, very common and is the leading cause of death, actually, heart disease. Fibromyalgia, chronic pain. And one thing that we don't talk about, depression, very, very important to be aware of depression because it affects a very large portion of the population as well. And that's something that we seldom talk about. So, stroke, which can also be associated with some of the other chronic conditions that we talked about, asthma and other lung disease. So, multiple sclerosis and other neurological diseases like Parkinson's disease, and also dementia, which is Alzheimer's disease, which is one type of dementia, is something that affects also a lot of people as they get older, most likely. But some people do get affected a little bit earlier. So something that we have to be very mindful of. I don't know if you have the ability to participate in a small poll, but if you're able to chat, uh, if you or somebody you know is affected by any of these conditions. I'm pretty sure that a lot of the participants here in this webinar have been or maybe know somebody who is affected by these conditions. So if you want to check some answers. Okay, yeah. So high blood pressure, very common, one of the most common uh, chronic illnesses. And one of the things that I mentioned earlier when we first started, some people don't know that they are affected by a chronic condition. And hypertension or high blood pressure is notorious for being one of the chronic conditions that is a silent killer. You often hear of high blood pressure being a silent killer, right? So yes, high blood pressure is associated with some of the other chronic illnesses that are being chatted right now. Heart disease, high cholesterol, diabetes, they're all related. And one of the things that we've noticed is that a lot of these conditions tend to walk in groups. So a lot of people who have diabetes, have high blood pressure, end up having heart disease, end up having cholesterol. So that's something that we have to be very mindful of. When you are affected by one of them, beware. Take care of it. Try to manage it because you don't want it to develop into some of the other chronic illnesses. So somebody wrote in the chat, I worry about my blood pressure and diabetes. So we're going to talk about if you are affected by some of those, what can you do? Okay. So one of the things that, one of the questions that we had, chronic illnesses, can they be cured? So we hear a lot about chronic illnesses and the burden that they have on the population, but can they be cured? And unfortunately, the answer is not technically no. So a lot of people who have high blood pressure, who have diabetes, are managing it with medication, with lifestyle. And we're going to talk about some of the things that you can do to improve and manage the chronic illnesses. But for the majority of them, they're not really curable. And all we can do is modify some factors to control them and keep them maintained and manage them. Okay. So, how do we feel about chronic illnesses? So whether you have been affected yourself or you know somebody who's been affected by chronic illnesses, there's certain symptom cycles that happen that affect you. So fear. So a lot of people are afraid when they hear, for example, you have high blood pressure, you have diabetes. A lot of people become afraid and they get scared. I'm so sorry. I have a visitor. I'm sorry. Give me 1 second. I'm going to take my son out. I am so sorry. I have a 5-year-old who has some learning disability and he found his way and unlocked the door. So I apologize. I'm so sorry. So we were talking about some of the symptoms when you're affected by a chronic illness. So fear, frustration. So fear of the unknown and being frustrated because you don't know what you can do about it. So fatigue, being tired. Like we said, chronic illnesses do affect the way you function. So they sometimes limit your ability to move, and you have to exercise extra effort to do things that were pretty easy for you to do before. So fatigue, so anger. So when we're scared and we're frustrated and we're tired and we don't know what to do, sometimes we get angry. Sometimes we wonder, why me? What did I do? You know, and one of the symptoms, unfortunately, that settles in sometimes is depression. So when you feel scared and you're frustrated and you're angry and you don't know what to do, sometimes you become hopeless. And then depression, anxiety, sadness settle in. And uncertainty, just unsure of the future. What's going to happen? Is this going to be the end of me? Am I going to succumb to this illness? So, a lot of people who are battling physical illnesses, unfortunately, also are battling emotional and psychological burdens that are imposed by those illnesses. And that's something that I usually tell physicians to think about because sometimes we get caught up managing the numbers, right? So your patient has diabetes, your patient has high blood pressure. They come to you and you tell them, okay, I need your blood pressure to be less than 140/80. I need your sugars to be less than 200. And we manage these numbers and we focus on the numbers. However, we ignore the patient. So we ignore what the patient is going through and some of the other symptoms that are contributing sometimes to the exacerbation of some of those chronic illnesses, and also symptoms that are caused by these illnesses. So it's very important to exercise a holistic approach when you're dealing with chronic illnesses. So, what are some of the risk factors? So, before we talk about what we can do, what are some of the things that cause chronic illnesses? So some of them are genetic, unfortunately. We inherit a set of genes from our parents, from both sides, and we don't pick which we get. You can inherit something good. You can also inherit some of those illnesses from your parents. So if you have a family history of chronic illnesses, does that mean that you are doomed and that there's nothing you can do and that's going to happen to you too? Not necessarily. There are certain behavior modification that will lessen your chances of developing a condition that you may have inherited from your parents. Okay, so good nutrition. Very important. So your diet that has fruits and vegetables, low in salt and low in saturated fats. So low consumption of meat and saturated fats and oils and butters and things like that, and starches, and increase your consumption of fruits and vegetables and fiber, foods that are rich in fiber and vitamins. That will lessen your chances. So some other risk factors. So lack of physical activity is a risk factor. And what can you do? Get up and start moving, start exercising. And it's important to do that one early, because what happens usually with chronic illnesses, you might be affected so much that your ability to get up and move might be affected. And then it's really too late for you to be able to do any exercise because you can barely stand up and you can barely walk. Okay. So avoid excess alcohol use. So they say one glass of wine for women, two glasses of wine for men maximum. Anything above that is excessive. So be careful. And also, not every day. So some people say, well, on average, if I'm supposed to drink one glass of wine on average per day, then if I drink four on a weekend, that's still less than the total consumption. Well, that math is not correct. So one per sitting. So if you're drinking one glass of wine per sitting, 3, 4 times a week, it's okay. However, if you drink all four at once, it's not. Okay. So that's the math. Tobacco use, very important. And not only yourself, but also secondhand smoke. So if you have family and friends who smoke, you can be affected as well. So it's in your best interest and theirs to ask them to stop. And if you're the one who's smoking, even more of a reason for you to stop, okay? So that you can avoid these chronic illnesses. Now, what else can you do to self manage your chronic conditions? I usually tell my patients, I will do my job. If I prescribe your medication, the medication will do its job. Now it's up to you to do your job. Because just like I can't do what the medication does, I can't do for you what you need to do for yourself. So when you think about chronic conditions, three parties are involved in terms of what happens, with the patient's treatment. So of course, the physician is going to assess the situation, make some recommendations as far as treatment plans. Now, the treatment, whether it's like therapy or medication or whatever it is going, or surgery, is going to do its part. Now, what can the patient do along with the physician so that they can help solve that problem? Okay. So self-management. So setting goals. What's your goal? Is your goal, you're a patient with arthritis, is your goal you want to walk your daughter down the aisle? You want to be able to walk down the aisle without falling? What's your goal? Do you want to play with your grandkids? Is your goal to go back to work? Do you want to go back to work? Do you miss working, or do you need it for the income? What's your goal? Do you want to exercise? Or are you somebody who used to run 5 miles and now you can't run 1 mile and you feel like, okay, my goal is to run 5 miles. You have to determine your goal, and you're the one who knows what that goal is. Usually when patients come, I tell them, what's your goal? What do you want out of this? Because I can have my own goals for the patient. However, if those goals don't match the goals that the patients have for themselves, it's not going to work. We all need to be on the same page. Okay. So once you've determined what those goals are, now develop an action plan. What are we going to do to reach that goal? Very important to develop an action plan, because that way you'll know what steps you need to take in order to achieve that goal. And you'll also know when you've deviated from that plan, because, excuse me, that plan that is taking you towards your goal, if you deviate from it, then you're deviating from your goal. And I'm not going to say it's impossible, but it's going to be very challenging to be able to achieve that goal if you're moving away from it, right? So very important, develop an action plan. So skill building, problem solving. What are the obstacles that are keeping you from being able to implement that action plan and reach your goal? So those are some of the things that you need to talk about with your doc. I see my patients very often. At Dedicated, one of the things that we do is we see patients monthly. And sometimes when we see a patient for the first time and we tell them, listen, we're going to see you monthly, and they're like, Doc, why do you need to see me monthly? I have diabetes. You get my labs today, just adjust my medications. I'll see you in 3, 4 months. No problem. But that's because they're not taking this approach. So when you're developing your goals and you're developing an action plan and you're building skills and problem solving and you're trying to solve the issues that are probably keeping you from that plan, we need frequent reassessment, right? You need to make sure that you're frequently assessing whether you're moving towards your goal or not. So behavior change strategies. Some of the obstacles that keep you from reaching your goal are behaviors that you've developed that are hindering your ability to reach that goal. So, part of treating and managing your chronic conditions is changing some of the behaviors that landed you there in the first place, right? So, for example, if lack of exercise was an issue for you, you're going to develop a plan so you can incrementally increase the amount of exercise that you're able to do. Now, you don't want to go from the couch to running a marathon. Probably impossible, right? So start with 5, 10 minutes of exercise per day. And 5 minutes is better than nothing. So you start 5 minutes for a week, a couple weeks, and before you know it, you would have built your endurance and you can do 10, 15 minutes until you build it up to maybe an hour or two per day. You'll be surprised how fast some people get there if they get there little by little. So behavior changes are the hardest to achieve. For example, eating. If you're used to eating a certain way for many years, it's very difficult to change that behavior, but it's not impossible. So make sure that you work and develop these action plans because when you have a plan and you know step by step what you're supposed to do, there's a very high likelihood that you will be successful. Community resources. So make sure you use the resources that are available. Like, for example, Center for Change is available. So use these resources that you have in the community so that you don't feel like you're doing it alone. Sometimes you might feel like it's unsurmountable, that you feel like the challenge is bigger than you. However, if you have resources and you have help and you're not in it alone, you definitely have a better chance of achieving your goal. So, how about the cost? So, chronic illnesses not only affect you individually, but it affects our society. So, think about it. A lot of people who are affected by chronic illnesses are not able to work. So, it affects the society economically because some people would have loved to work. Some people are not of age of retirement. However, they're not able to work because of chronic illnesses. The CDC says annually healthcare costs for chronic illnesses is about the, well, actually, I take that back. Chronic illnesses are the leading driver of that cost, of healthcare costs. So about $3.8 trillion are spent annually on healthcare costs. And chronic illnesses are the major drivers for those healthcare costs. So not only it's affecting society as a whole in terms of the workforce and also affecting families. There's a lot of people who are not necessarily affected themselves by chronic illnesses, but they have to take time off of work to take care of a family member or friend who is affected by a chronic illness. So you can think of so many ways that chronic illnesses are affecting society. So there's a question. Um, do I refer patients to a registered dietitian? So that's a very good question. So it depends. Uh, First, you have to assess if the patient is able to make those changes on their own. And how much of an understanding that they have about nutrition. Some people know more about nutrition than others. There's patients you can tell them, okay, listen, you have to decrease the amount of carbs that you eat. You have to increase the amount of vegetables and fruit. And they go and they know what to do. Some people don't. One of the things that I used to do, we used to run a diabetes program and we went to the basics. So what we did, I did classes with the patients, And we went from the basics of learning how to read labels to knowing what to do when you go into the supermarket. So I had them bring things from home, bring the cans, all the cans and boxes and bags of everything you have at home. And you'll be surprised. The things that are labeled healthy may not be. I remember that day there was a patient who brought a bottle of some natural carrot juice. And I said, okay, yeah. She's like, yeah, it's really good. Dr. Cerphy, it's really good. I've been drinking it for years and it's natural. You see, it says it on the label, it's natural. And I said, okay, well, let's flip it over. I told her, the only labels I'm concerned about are the labels in the back. I don't care what the labels in the front say. I need to see numbers because numbers don't lie. So we flipped the bottle and added sugars, preservatives, and chemicals and colors, and she was shocked because a lot of the stuff that's written in the front is advertising. So the back, you need to look at the back. And if you don't know how to read your labels, for example, if you have issues with learning how to read your labels, knowing the different groups of foods that you have to eat, and also patients who have very complex medical conditions that require a lot of restrictions, yes, I will send them to a dietitian. But most patients, when we see them frequently, you see them monthly, twice a month, and you go over these, if they don't have anything that's very complex that requires a lot of restrictions, then we're able to manage without having to send to a dietitian. So it depends. So most chronic illnesses progressive, can they be managed over an extended period of time? So it depends. So you have some chronic illnesses that are manageable and that don't necessarily progress. Like for example, you can have a patient who has diabetes, has caught it early, has made the changes in their diet, exercising, their sugars are controlled on diet alone, no medication. And you can have another patient with diabetes, maybe didn't catch it as early, maybe not making some of the changes that they need to make because it's difficult, and their condition progresses faster than somebody else. So it really depends on the condition, one, and also on the patient and the changes that they're willing and able to make at the moment. So it's all relative. So that's why it's important to take your health in charge. So when you go to your doctor and they, unfortunately diagnose you with a chronic condition, it's okay. You just know now you have changes to make and you have to be up to it. Unfortunately, there's no way around it. Got to make those changes in order to be able to manage those conditions. Otherwise, most likely they will progress into, they will progress. Okay, so chronic conditions, very wide variety of different chronic conditions that affect multiple organ systems. Okay, so you have chronic conditions that affect your heart, you have chronic conditions that affect your lungs. Okay, you have chronic lung diseases that are related to behavior or not. So you can have things like COPD, chronic obstructive pulmonary disease that affects your lungs. That's a lot of times related to smoking. But you can also have chronic asthma that a lot of people get from childhood or develop, in their youth. And it's actually not related to behavior necessarily. Okay. So we said heart disease, you can have strokes. Some people have, unfortunately, debilitating effects from stroke, paralysis, and weakness, and so forth. You also have something that we don't always think about when we think of chronic illnesses, like we talked about earlier, Alzheimer's disease, dementia. Dementia is a slow, progressive, most of the time, slow, progressive illness, and we don't think about it as a chronic illness. But it has all the characteristics that we described before, and it has also that burden on society that we described before. So yeah, it's part of it. Chronic kidney disease, which is a lot of times a consequence of some of these other illnesses that we talked about. Notoriously high blood pressure and diabetes. So chronic kidney disease is a very common consequence or complication of diabetes and high blood pressure, especially if it was not managed effectively or if it was not diagnosed in time. Okay, so we're going to take a closer look at some of those things that we talked about, these chronic illnesses. Okay, so heart disease, what happens when you're born? Your arteries are squeaky clean, right? And as you get older, with things that you eat, we eat things that have, that have fats, that have oils. And unfortunately, some of those deposit in the arteries and cause hardening of the arteries. So when the arteries are not as flexible as they used to, then what happens? You get a lot of times high blood pressure, which is related to hardening of the arteries, which can in turn be related to heart attacks and stroke. So, like we said before, a lot of these walk together. Okay. So, diabetes. What is diabetes? So, when you have diabetes, you have an ability to effectively process sugar in your body, right? So, that happens, your sugars go up, and sugar was not meant to be floating around in your arteries. That causes inflammation, and again, causes the same process that damages the arteries and can also be a risk factor for heart attacks and strokes. So you see the connection, right? So some of the other ones, so cancer, so many different types of cancer, and that affects so many different organ systems. So sickle cell is another one that we don't talk about a lot. It's an inability for your red blood cells to carry oxygen very well. So it changes their shape and it affects the blood, and it causes a lot of different complications that have to do with the circulation. So poor circulation, some people could develop clots, unfortunately, from these abnormal sickle cells, these sickled red blood cells, aggregating inside the vessels and clogging them. Okay, so you can have stroke if these vessels that are going into your brain are clogged. You can have a stroke. There's just a lot of different complications, very, very severe pain when you get issues with the bones. So it's very important to know that you have a chronic condition so that way you can battle it, you can tackle it, and get better. So now we're going to shift gear to COVID-19. So I don't think there's anybody right now living in 2021 who is not aware of COVID-19, right? And the effects that it has on the society. Now, COVID-19 associated hospitalization related to underlying medical conditions are higher than people who don't have medical conditions. So you know that when you have a medical condition, it increases your risk of developing complications from COVID-19, and also increases your risk of death. So what happens is when COVID-19 attacks you, the healthier your body is, the more you're able to fight, right? So you have more symptoms if you have chronic illnesses, chronic conditions, because your immune system is probably weak and you're fighting so many things already. Now, when you add COVID-19 to the mix, you're not able to fight it effectively. For example, I don't want to use the example of people fighting, but it's easier to fight one person than to fight two, three, four people, right? So if you're only fighting COVID-19, you probably have a better chance than if you're fighting COVID-19 and diabetes and high blood pressure and heart attack. And yeah, you get my point. So it's very important to think about some of the other repercussions of these medical conditions, which is making you more susceptible to complications and not being able to fight other conditions as well as you necessarily would. So as far as COVID-19 is concerned, you know how to make sure that you protect yourself. Okay, so make sure that when you're walking out, that you have your face covering, and make sure that it's covering both your nose and your mouth. Okay, because I see a lot of people walking around with their masks here. I see people walking around with their masks on their chin when they're talking. Then you're not being protected. You know, you have to make sure that if you're going to wear your mask, that you're going to wear your mask effectively in a way that it's going to protect you. Uh, let's see if we have any other questions. So yes, we do have a question. Um, Taking second COVID shot and has high blood pressure and diabetes. Should I be overly concerned? I wouldn't say more concerned than anybody else. So the fact that you're taking your second COVID shot is a good thing. So I would say you probably would be more concerned if you were not taking your second COVID shot, if you were not taking your shot. So the shot, as you know, is both shots, as you know, there's two vaccines available on the market right now. So we have the Moderna and the Pfizer, and both of them are greater than 90% effective. Okay, so that is pretty good. And the side effect profile is very mild compared to some other vaccines. I remember last year, no, the year before, I went to, in 2019, I went to Ghana on a mission trip, and I had to take a yellow fever shot. I took a yellow fever shot, and the next day I felt like somebody beat me up. And I know I didn't fight anyone, but my whole body was aching, and just carrying my bag, I honestly thought that I pulled something, and I had so much pain. I took my COVID-19 shot a month ago, and I have the next one, the second one, this coming up this weekend. And I had a little bit of soreness in my arm, and that's it. When you think about it, there's other vaccines that have been around for a long time that have a lot more side effects than the COVID vaccine. And a lot of people are afraid of the COVID shot. And I know it's new, and that's probably one of the reasons why people are afraid, because of the newness. However, compared to other vaccines, the side effect profile is really not that bad at all. And most people that I know who've taken it have a little bit fatigue, some aching. However, what I experienced when I took that yellow fever shot, yeah, most people that I know have not reported anything in that to that that magnitude. So, if you have a chronic illness, is it recommended to take the vaccine? Absolutely. Like we talked about, chronic illnesses put you at a higher risk of developing complications if you are affected by COVID-19. So it's even more important for you to take the COVID-19 shot if you have a chronic condition. That was a question. Thank you for posting the question. Uh, I'm sorry, give me 1 second. Okay, I'm going to stay here. All right. So I apologize. I think I'm going to have to finish this with him on my lap. So and this is, for example, one of the things that we're talking about. So this is my son. He was diagnosed with autism. So sometimes it's difficult. I have to make adjustments. I try to hide in the house so that I can do this webinar uninterrupted. But unfortunately, he finds ways, and he doesn't understand. So sometimes we have to deal with it. But it's the same thing with chronic conditions in adults. Sometimes we have to make adjustments. We have to make changes so that we can manage effectively and efficiently. Let's see if we have any other questions. I know there's probably a lot of questions around COVID-19. So impacts of COVID-19 on chronic illnesses, okay? So we know that about 41% of US adults have avoided medical care during the pandemic because people want to stay home. And I don't blame you. You don't want to go outside and be affected by COVID-19 unnecessarily and be exposed. You don't want to leave your house and go to the doctor and come back home with COVID-19. We definitely don't want that. So even for some of our elderly patients, we did tell them, listen, we may not be able to see you as often because of COVID-19. Now you can imagine, what does that mean? So 55% of patients with at least 2 or more underlying conditions have avoided care. Either avoided care purposefully, or were not able to, because there's a lot of doctor's offices also that were closed. Okay, and there were some times that we were not able to go. There was curfews, so people were not able to go out in the street. 42% of people without insurance compared to 25% of people with insurance avoided care. So the people that were most affected are people without insurance, of course. They're the ones who receive less care to begin with. Okay, so now let's talk about race. So 55% Hispanic, 48% Black, non-Hispanic, so 36% white, non-Hispanic avoided care. So you see a trend here as well. So Blacks and Hispanics were most likely the ones who avoided care. So 49% believe that So 49% believe to be in a group of high risk for COVID-19, and compared to 39% that were not in a high risk group. So unfortunately, the people who avoided care were also the ones who were at higher risk because they were the ones with 2 or more chronic conditions. So you can see a pattern here. So not only COVID-19 had an impact just because it's a pretty virulent disease. However, the people who needed care the most were the ones who avoided care. And when you don't take care of chronic illnesses, what happens? They get worse. And you get worse, your chronic illness is not well managed, you face COVID-19. You can think of the consequences. Higher hospitalizations, higher risk of complications. So very important. Like somebody said earlier, if I have a chronic disease, should I take the vaccine? Absolutely. If you have a chronic disease, should you be going to your doctor and making sure that everything is right? Absolutely. Just in case you face COVID-19, you want to at least make sure that your conditions are controlled. So make sure if you have a chronic illness like diabetes, high blood pressure, high cholesterol, cancer, or any of the other chronic illnesses that we talked about, arthritis, or any of the other inflammatory diseases, make sure you're taken care of. Make sure you're making the changes that your doctor asked you to make. Make sure that everything that you need to do in your power to control those illnesses that you're doing. And also make sure that everything that's in your power to avoid contact with COVID-19, so social distancing, mask wearing, make sure you're doing that because it can be a matter of life or death in some circumstances, unfortunately. Don't want to scare you, but in some cases it is. And I've seen, I take care of seniors, 65 and over. And I've seen some unfortunate situations that could have been avoided just by knowing that you have the power to do something about it. You can. So whatever you can do, please do. So COVID-19, there's a question. COVID vaccine for the elderly, 90 plus. How safe is it for the population in that age group? So I have, like I said, we take care of elderly patients, and we want them to be vaccinated. There's a restriction, 16-year-old, so you don't want to give it to children. However, your elderly patients, your grandmothers, your great grandmothers, especially the ones who have chronic illnesses, yes, there is a restriction for patients who've had what's called anaphylactic shock. So if you have history of very bad reactions requiring like EpiPen, you might want to talk to your doctor. Some people can still take it depending on what you've reacted to. If you haven't reacted to a vaccine before and it's like maybe like a food allergy or something like that, you probably could still take it. I know someone who has really bad food allergy actually carries an EpiPen that took her COVID vaccine and she was fine. If you've had reactions to vaccines before, I definitely get clearance from your doc. But otherwise, I think it's pretty safe. Most people that I know, most of my colleagues have taken it, friends have taken it. My parents actually took it today. Both of my parents took it today. So I definitely advocate for people making sure that they take their vaccine if they have access. I know it's difficult to get access now, so get registered. As soon as they get supplies, they will call you. Okay, I don't see any more questions. So this is what I had prepared for you tonight. I hope that was helpful. I hope that this was informative. I apologize for the extra guests. I know you only planned for one guest tonight, but you ended up with an extra guest. Thank you so much. It was a pleasure.
Thank you so much, Dr. Cerphy. It was incredibly informative, and I can't thank you enough. I learned a lot. I can't speak for all the participants, but I know I learned a lot. And our second guest, he was just as welcome. And on behalf of Center for Change and our executive director, Peggy Burgess, we would really like to thank you for coming and providing such life-saving information. And all of our attendees, we want to take the time to thank you for taking time out of your busy day to come and join us and just wanting to be more informed about how to better self-manage your chronic conditions, even through this whole COVID situation. Now, tonight or tomorrow, you are going to receive a post survey. And in that, we are going to ask each of you to complete that. Now, we have a gift package for each of you, and we'll be mailing that out within the week. Please ensure that we do have correct mailing addresses for you. Or, of course, you're always welcome to come by the office and pick it up. Our address is 6003 Silver Star Road, Suite 3, and Orlando, Florida, 32808. And if you have any questions, please know that you can always contact us here at the office. We're at 407-271-4452. And again, thank you all so much for taking the time, for participating with us. And please, everyone, have a great evening and good night.